Good afternoon. My name is Helena West. I'm the committee clerk. I'm going to provide a very shortened protocol for electronic participation in this meeting. To have a full view of the presentation slides and other meeting materials, please go to the layout on the top right-hand side of your screen and use Focus View, which will provide a full view, or Stage View, which is a presentation with the thumbnails. When voting, recorded votes are not allowed at committee meetings. The committee chair will call for any objections. If you have an objection, indicate your name and the objection. If no objections are stated, the motion will be deemed to be approved. Departures. If you're participating electronically and are leaving the meeting, please send an email to council@peelregion.ca to confirm that you are leaving the meeting. If you leave the meeting for any votes thereafter, you will be marked as absent. To request to speak. If you would like to speak, please email council@peelregion.ca or simply raise your hand, right hand option on your WebEx screen. We shall now commence the meeting with roll call. Please indicate your presence by responding here when called upon. Councillor Demirla.
Good afternoon, I'm here.
Thank you. Councillor Downey is on other municipal business. She will not be in attendance. Chair Fonseca.
Good afternoon, I'm here.
Thank you. Councillor Groves. Councillor Groves. Regional Chair Ainika is here in the council chambers. Councillor Medeiros. Councillor Medeiros. Councillor Sado is away due to a personal matter. Councillor Vincente.
Here.
Thank you. Advisory Member Cripps is not in attendance today, as she was required to attend other meetings regarding the pandemic. Advisory Member DeManuel. I believe that she also had other business. Advisory Member.
It's Sean Kerr here representing Trillium.
Thank you. Advisory Member Kerr, thank you. Advisory Member Dr. Mohammed.
I am here.
Thank you very much. And I believe also that Kiki Ferrari is joining us as a guest today.
Yes, that's
as an
correct.
Advisory member. Thank you. We require 5 members of the committee to have quorum. We currently have 4 council members, so we do not have quorum. However, the agenda does have 2 information reports and a presentation. We can proceed with those 2 reports. Thank you. I'll turn over the meeting to Chair Fonseca.
Thank you very much, Helena. So I would like to welcome everyone to the Region of Peel Health Systems Integration Committee meeting for Thursday, January 21st. For those that I haven't had the opportunity to see virtually since the start of the new year, I wish you a very happy new year and look forward to working with all of you moving into 2021. And since the last time we did meet, I know that all of you have been very involved in supports recovery through this pandemic, and I just want to extend a sincere thank you for all that you are doing to support the Region of Peel through this pandemic and the recovery into 2021. So with that, I will move on to declarations of conflict of interest. Seeing and hearing nothing. I move on to item 4, delegations. We have none, so we are moving on to the reports, and these are items for information. So the first is 5.1, an update on supporting seniors in Peel. And we do have with us Donna Kern, who will be doing the presentation here today.
Chair Fonseca, it's Nancy.
Oh, hi, Nancy.
Hi, my apologies for interruption. Unfortunately, Donna's computer just shut down. She's just rebooting. So I wonder if, through the chair and the committee, if you would be able to go to 5.2 and just give her a moment to get back online.
Okay, not a problem. Thank you very much for providing that update. So 5.2, just looking to Helena to clerk. So for 5.2, this is an information item, an update on health systems transformation in the region of Peel, but we do not have a presentation, correct?
Yes, that is correct. I do believe that Brian Laundrie is here to answer any questions regarding the report.
Okay, so we have, thank you very much. So for 5.2, we'll bring this forward, and there isn't a presentation, so just looking to, and Helena, you may have to help me. I do have, I'm not seeing any hands raised, but wondering if anyone has any questions.
I'm not sure if maybe Brian might like to give a summary while Donna's getting up and ready. Thanks,
Excellent
Brian.
suggestion. Thank you, Brian. Go ahead. I think he may be freezing as well. We can't, Brian, we can't hear you. Okay. Oh, maybe he's back. Brian, I can see you on the screen. Can you hear us? Still not able to hear. Can see you, but not hear you. Oh, Nancy, you also are muted. Having a few technical difficulties. You're muted. There you go. There you go.
Okay, it looks like everyone had a shutdown at the wrong time, so his computer has just shut down as well, and he is booting up. So how about if I give a quick overview on 5.2? May not do as well with the details, but I'm happy to provide committee an update. So 5.2 is really to provide the committee a status report on where we are with regards to health system transformation, which speaks to what we're doing both at the region of Peel, but also through our partnerships with some of the advisory members that are currently sitting around this table. So with regards to transformation, there's been a number of things, as this committee knows, that have started over the past year. The biggest is the transition of our 14 LHINs into Ontario Health and Ontario Health teams. So pre-pandemic, that work was certainly underway. As committee and council knows, the region is working in partnership with 3 OHTs across the geographic area. That's the Hills of Headwaters, Mississauga, and the Brampton Etobicoke OHTs. So those partnerships, while in different forms and at different points in development, are underway. During COVID, however, some of that development of those OHTs and the maturity or evolution of the OHTs did slow down, and have now refocused on pandemic. And in essence, for instance, with the Brampton Etobicoke OHT, actually with all 3, they are now as members, as part of the health system leadership group or table with regards to the mass vaccination. So in essence, that is the key, that's the point there, is OHTs continue, those relationships continue to build and form, and at the same time, because we've all have those relationships. They've been great support in getting through the pandemic and supporting our community in far different ways than we would have been able to do in the past. In the meantime, the province continues to work, but very slowly, on the development of Ontario Health as well as those teams. We have also looked at public health and emergency management, health transformation, and those have been discussion points as far back as 2017 with regards to potential health transformation for public health. As Council knows, that too has slowed down with the pandemic. There was an audit that was that was done by the Governor General, and I know Council received information from Dr. Lowe about that as well. Again, in that report, it speaks primarily to the work that has been done during the pandemic and how we can continue to improve it. But certainly there are elements of health transformation opportunities for future. So the team here at the region with public health and through Dr. Lowe, we continue to keep an eye on that piece, knowing that once COVID is finally taken care of, and I hope that is soon enough, that health transformation may be a topic of conversation that we will continue to work through and keep Council apprised of. Home and community care was the other piece, and certainly under Ontario Health as well. And again, this is and has been an advocacy position for the region for some time with regards to ensuring that the residents of Peel receive the funding support from the province that is required, knowing that both the Mississauga Halton Land and the Central West Land, when they were in their full existence, were the lowest funded across the province. So that advocacy continues, and again, a lot of work and relationships with our home and community care partners. Certainly through the OHTs is where it's its strongest, but again, it's through that group that we are garnering support with COVID, including such things as testing sites and supporting our own adult day clients that are now at home and not within our programs live. So I think that provides a nutshell for Committee of Council. I understand that Brian is now back online. We do have Dr. Lowe here as well from a public health perspective, and we are happy to answer any questions. And certainly our advisory team is here.
Thank you very much, Nancy, for that update and overview. I'm going to pass it over to Brian to give a further update. So go ahead. Brian, I think you're still on mute. I think he is still having some issues with his microphone. And now he's no longer. Oh no, he's there on the screen. Just can't hear him.
This.
Oh,
Does that work?
There we go.
I think 2 thumbs up.
Yes.
Dave's getting tired of this. Sorry, my apologies. And through the chair.
Take a deep breath. Everything's fine.
Thank you, Councillor Fonseca, and through you to Council, my apologies, and I'm really hesitant to start filling in any further gaps given that excellent update that Commissioner Falcinelli just gave. The one piece I might add, because I could hear her, I just couldn't connect, was on the mental health and addictions advocacy. If you'll recall at our last HISIC meeting, we gave a presentation on that file and on our advocacy and on all the update from the roundtable that we had with Minister Tabolo the previous October, And through this committee, we were encouraged to bring forward the mental health and addictions to full council, and we had a very energetic conversation for, I think, almost a couple of hours on that. And we have, as a result of that, we've taken away advocacy positions to work with targeted groups, targeted strategy of key stakeholders and influencers to support mental health and addictions. I understand that there is to be, or was almost imminently, or just has been an further announcement about mental health and addiction funding, which we have just got a real brief insight to. To date, there's no specifics about how Peel or the hospitals within Peel will benefit from that, because part of that funding was targeted to the hospital sector, 13 specific hospitals, I believe. So that was really the piece that from the report that I just wanted to pick up on. And then just on the integration front, as our mass vaccination plan unfolds and continues to get built out, there's a very deliberate and conscious effort to do this as system-wide partnerships and through our collaborations across the region. Nancy did refer to that, but just a little bit more detail. We've established community planning tables with our Ontario Health and Ontario Health Team partners and key stakeholders within the community to help the planning and take that input to make sure it's as coordinated as possible across the system. We're also establishing a community equity and engagement advisory table, which will be our linkage and provide our insight and from our community experts on how we can interact and appropriately plan our vaccination services and for our all the communities within Peel, including our vulnerable communities. And so those tables are two that have been established to really ensure our integration with our colleagues and with the whole entire health and community services system. As we know, this is going to take an effort across all partnerships, and also to get really strong linkages and information and input to those processes through our community groups. And many of those we have are similar to those that we engage with through our community safety and well-being development and through our family and intimate partner violence campaigns as examples. So I think we're well on the way to establishing those tables, and they will be influential in the mass vaccination planning. I think I'll just leave the update there if anybody has any. Thank you.
Thank you very much, Brian. I'm not seeing any hands up except for Elena's, and I believe that is because we're now at quorum. Go ahead, Elena.
Yes, that's correct. Councillor Sato has joined the meeting. Thank you. And I also believe that Donna Kern is back online.
Okay, that's great to hear. So I'm not sure if anybody had any questions or any comments with regards to 5.2. Still seeing no one. So with that, I did want to say thank you very much to Commissioner Polsinelli for the update, and also to you, Brian, for the update. This report it's a fulsome report, and just drawing everyone's attention to the appendices and the milestones, the key milestones that the region of Peel, along with all the community partners in the region of Peel, contributed to those milestones, as both Nancy and Brian pointed out. The collaboration in the region of Peel has been, it's been extensive throughout 2020. Ontario is clearly undergoing significant reforms when it comes to the health system and health system transformations. And while certain milestones have not been able to be achieved because of COVID, we've definitely taken the opportunities to work together to find solutions to address region-wide responses towards not only COVID, but also moving forward for collaboration and health system integration. So I guess my one question would be, because Donna Cripps was not able to be with us here today, we've had this update, but as the report references, there will be other updates to come. Is there an opportunity to put this on the next agenda, which maybe, I'm not sure that for the date, or would that be too soon, or would we be looking to, I hope we will be looking to have it on a future agenda, and perhaps at that point, I can coordinate Donna Cripps to be able to present as well.
Sorry, Chair, is that if I could step? Yes, I'll definitely reach out to Ontario Health and to ask them and provide that direction from you that we would like to have them come back to a future council meeting. We just have to we just have to have that caveat that we could still be in the same situation in May. So that's just a little bit of caution there, but absolutely we can have that conversation with Donna and have her thoughts on it.
May be too soon, so, but okay, that's great. Thank you very much. So we do have quorum now, so we can, and I don't see, again, just checking to see, I don't see any hands on the board. So because we have quorum, could I get Councillor Vicente to move receipt of the report? So thank you very much. And any objections? Okay, wonderful. Thank you. Moving back to 5.1, so an update on supporting seniors in Peel. And there is a presentation with this report, and that is just looking, yes, Donna Kern will be doing this presentation.
Thank you very much. Sorry about the technical difficulties there earlier. Glad to be back. So the presentation's up. Great, thank you. Good afternoon, Chair Fonseca, members of council, and committee members. I'm Donna Kern, Director of Senior Services Development, and today I'm pleased to provide you with an update on regional work related to seniors' supports and services. Next slide, please. The impact of COVID-19 on seniors was witnessed by us all. As we are all well aware, chronic underfunding has resulted in severe service gaps across the home and community care and mental health and addiction sectors. These existing pressures were only amplified during the pandemic and had dramatic social and psychological impacts on the seniors' population. For many seniors and their caregivers, the pandemic meant that social networks have been diminished, daily routines and consistency were disrupted, and activities and programs that once provided respite for caregivers were shut down. Next slide, please. The region swiftly responded to needs of vulnerable seniors in the early days of the pandemic by innovating our service delivery approach to remote care and establishing a number of cross-sector action tables. The pandemic propelled cross-sector collaborations to a level never seen before. In all the examples listed on this slide, organizations across sectors and across municipalities came together, identified urgent priorities, and collectively developed new and innovative solutions to respond to the needs of the community, Strong synergies and relationships have been established and will last well beyond the pandemic response. Next slide, please. Across many multi-sector collaborative tables, three common themes have emerged. There's a strong and growing appreciation for upstream population-level intervention to address health outcomes through holistic approaches. This momentum has translated into system-level willingness and commitment to cross traditional sector boundaries and to collaborate as one system to create integrated, timely, and client-centered solutions for the most vulnerable members of our community. Secondly, week after week, we have seen consistent dedication and active participation from a wide range of stakeholders at our planning and action tables. These include our area municipalities, Ontario Health, area hospitals, and the large network of community agencies that work at the forefront of service delivery. And lastly, we have heard a resounding desire for the region to lead and provide system-level leadership to advance a region-wide seniors strategy. Akin to the model undertaken to develop the Community Safety and Wellbeing Plan, the community relies on and values the region's expertise in large-scale response coordination, data and business intelligence, reporting, and advocacy. Next slide, please. Responding to the pandemic has catalyzed opportunities to advance community for life for our seniors, including the term of council priority to enhance seniors' supports and services. First, we are building a seniors master plan with our community. Community agencies that are active in senior services have expressed a strong interest and desire to both build and help implement a region-wide senior strategy. Many have a wealth of local experience and practical insight to share. For example, all three local municipalities have a seniors or older adult focused plan, and they are looking to the region to be the unifying force to coordinate and build synergies amongst these strategies and to build an overarching framework to help align efforts and to help identify and address system gaps. To bring the master plan to life, we will engage closely with community advisory bodies, such as the Peel Council on Aging, which is currently under development, led by Peel Senior Link, to ensure that the community voice is at the heart of all service planning and delivery. We will sustain ongoing forums for system-level collaboration. The community frequently looks to the region for backbone support and to be the convener that brings people together. The seniors community is asking the region to continue to provide platforms and opportunities, like the community response table, for collaboration among health and social service providers. Our community is also relying on us to support and further strengthen the volunteer sector. Through volunteers, we can expand our network and reach a greater number of seniors. And through the act of volunteering, volunteers, many of whom are seniors, are able to contribute their time, wisdom, and continue to find purpose and meaning as they age. One example is a new partnership between Regional Volunteer Services and Peel Housing Corporation. And lastly, we will improve system coordination. Community partners in the senior services community have traditionally been widespread and functioned independently. In wave one of the pandemic response, our partners saw possibilities to improve coordination. They want to continue to work with the region and with each other to enhance processes and service coordination and bolster service pathways to support crisis response in the future. Next slide, please. So as we move forward, the size of the seniors population continues to grow, and seniors and their caregivers will continue to be vulnerable. As a key system partner, the region plays a critical role in planning and delivering holistic, upstream, community-based solutions that focus on helping seniors remain healthy, independent, and living in their communities longer. We do this by addressing the social determinants of health and, in turn, safeguarding the acute care health system for the most urgent and complex cases. Going forward, the region will engage closely with the community and will remain agile in our approach. We will lead large-scale initiatives like the Seniors Master Plan that will have far-reaching impact across Peel. We will support our community partner agencies with backbone expertise and facilitate opportunities for collaboration and learning. Similar to the central roles that we have played in community safety and well-being, the region will coordinate and facilitate to integrate efforts, build solutions, and help advance a shared vision to build a community where seniors can age well. And as always, the region is committed to actively take part in discussions, implement solutions, and learn from the community as we build a community for life for our seniors together. Next slide, please. So thank you, and I'm happy to answer any questions that you may have.
Thank you very much, Donna, for that presentation and that update. Not just looking to the board, not seeing any hands raised. So not seeing any. I guess you answered. I did have two questions, but you actually answered both of them in, Councillor Sato? Okay, Councillor Sato. Go ahead.
Sorry, thank you. I was having trouble getting in there. I've got three screens going at the same time. And I apologize for being late. I had the meeting in my calendar starting at 1 o'clock, not 12:30. So I thought I had all kinds of time. So I apologize for that. So just a couple of questions. Reading the report, and this is an issue that I guess I brought up quite a bit, and maybe you could just expand a little bit on it. With regard to the day centers for seniors, and as we come out of COVID, and of course, it's not something we're looking at right now, but as we come out of COVID, I guess part of my concern is that we are not locating the centers scattered throughout the region. We're focusing them on a few locations where many seniors just cannot get to, cannot access. And I've raised this with the commissioner a couple of times, and with Commissioner Sheehy actually. And I guess what I'm looking for is going forward that we are providing those types of services to the seniors in more neighborhoods, and I'm not seeing that in what we're how we're looking forward. We can at the city, we can provide the recreational facilities, but again, those are in the community centers, and in my ward, I have 3 seniors clubs, which each one of them has one has 200 members, one has over 300, and the other has, I think, 300 to 400. And 2 of them are cultural. One is South Asian, the other Chinese. So very many of the seniors don't speak English that are in those 2 clubs. The other one is a little bit more general and brings people in from all cultures and languages. So, with the large numbers that I have there, those seniors can get out to the clubs. But I know that there are probably just as many that cannot access the clubs, or, who still need a day type of activity service. And I was hoping when Trillium was looking for the new extended care facility and urgent care facility, one of the locations that I was discussing with Sean actually was an area in my ward where we could link a senior center with what the hospital side was providing, and have that synergy between the two, so it would basically become a day center for seniors. But that unfortunately is going to be located somewhere else. So I don't have that. So can you just speak to that how are we going to address, it's really a matter of getting, getting those seniors who are not club members out to some kind of a day service. And if they have a caregiver, having that day service for them is just so invaluable. I do have the Alzheimer's day center in my ward, but it's very, very small. And it can really only accommodate a very, very small number of people. So, the need is there. I know they have a waiting list, but I'm just not seeing what I would like to see in today's report.
Sure.
Yeah, go ahead.
Sorry, thank you. Through you, Chair Fonseca. I can certainly answer some of your questions, and certainly others can jump in afterwards. Certainly the pandemic has given us great opportunity in the adult day world in terms of catapulting programming to years in advance, to places where we never even imagined before the pandemic, in terms of virtual programming and also mobile programming. So these are fantastic opportunities which have really developed since the pandemic and has really helped us with our reach. The other benefit that's come out of the pandemic is both the Central West Lynn and Mississauga Halton Lynn adult day networks have come together, really working collaboratively to problem solve and to collaborate and to figure things out together, much like the community response table did. And out of that developed relationship, they are looking at problem solving ways to look at shared waiting lists, shared programming, and working in such a very different way than we ever even considered before the pandemic. So those are good news stories in terms of off-site programming that will continue post-pandemic in terms of virtual and mobile reach to a broader audience. And of course, the issue of in-person programming, our funding is tied to what we're funded by the local health integration networks at this point. And I'll leave it there in case there's any other comments.
Yeah, before anyone else comments, I like the idea when you mentioned the mobile, because that's actually real people. Virtual has been fine, but it's still, I'm sitting here on a virtual meeting, and I'm in a room by myself, and my dog is keeping me company. It's not the same as being physical, and I think we've all experienced this. We've been doing it for 10 or 11 months now, and that human interaction, the real personal interaction with someone. I know some seniors have told me that, they go out, they're frightened, but they go out to grocery shop because they just need to be around people, and some of them can walk over to, to the Metro store or whatever, and they kind of get their dose of real live people to, that they're not isolated. And virtual, we're hearing that from the kids from the schooling as well, that, virtual is fine, but we can't. And I guess my fear is that we have to do virtual now. Right now it's a necessity, but I really don't want to see us focusing so much on the virtual as we come out of the pandemic that we are not building the real personal interactions. For the senior that cannot physically get out, it might work. I always think it's better to get somebody to go and help them get out. But, you know, the virtual to me is it's kind of at the bottom of the scale of things that we should be doing, things that we should be looking at. And, you know, just from a mental health perspective alone and a physical health perspective, you know, I think getting people out of their apartments, many of them are in apartments, getting them to come out that door, I think always should be our goal when it relates to seniors. I'd like to hear more about the mobile, not necessarily now, but the mobile service, which I'm assuming would be, you know, we would have a group go around to buildings and invite the seniors to come out and do activities or something. I think that's a great way and probably a less expensive way. It's kind of like the old bookmobile system. A less expensive way of covering all of the areas of the city. And I would certainly be interested in looking at what funding is available for that type of program. I know how much that worked and how much that helped seniors when we took, basically took the show on the road to the seniors' long-term care and retirement homes with entertainment through the pandemic. It meant a lot because at least it got them to their windows, those that could not physically come outside, but many came outside, which I think was a real plus. So I think that's where we really need to be leaning and not depend so much on virtual that we get too hung up and solely focus on that. You know, I guess I'd really like to hear what other suggestions there are, but I just wanted to throw that out to you. Thank you.
Thank you, Councillor Sato. I do believe, so I see Sean Kerr, your hand is up. Are you're responding to Councillor Sato and or to Donna's presentation?
Yes, through the chair, I thought I'd just offer kind of a couple thoughts to Councillor Sato's comments there. I think you know, the balance of virtual care is something to figure out. We have now catapulted virtual care like we never believed could be done over the last year, and there's been a lot of really, really positive things there, and we've stretched ourselves in areas that we didn't really think we were comfortable in going in, and now we do know we're comfortable being there. But for many things, it does not make up the human interaction, the direct interaction. There's lots of, I'd say, I don't want to say transactional, but you know, certain medical services that we can absolutely be doing virtual, and it's going to be a much better and more efficient care model. But there are very, very important things that still need to be offered in person, and I'm sure the team's been kind of considering that. So I would just offer my view that it is a bit of a balance between those two items. And then just more specifically, you know, as we're thinking, you know, Trillium's thinking about, you know, future senior services. We do have the Speakman Health Hub, the new health center in Sheridan Research Park with the 2 long-term care homes. We have a plan for an adult day program in there, dialysis, a number of integrated services, hospice. And the way we're thinking about that is really leveraging virtual where it makes a lot of sense, where it can build up some capacity, but we still believe that in-person connection and care is still a big part of the future. And we still do want to find a property in North Mississauga. So Councillor, just know that, you know, we still are interested in another property, and our view is that you know, having those integrated senior services for community members is pretty important part of the continuum.
Well, I'm glad to hear that, Sean, because I thought we were losing that for the Northwest when you went with the one down in the South End. And you know, I want to throw out another thing that when you mentioned that not all the seniors qualify for Trans Health, and those that don't, I think we need to take a look at how do we get them efficiently to the day programs, because some of them we don't want driving. You know, if they're depending on their health, you know, not their age necessarily. I mean, Hazel's almost 100 and she's still driving, so you can't go by age. But you know, for whatever reasons that they should not be or do not drive, I think we need to take a look, and there's your mobile thing again. You either bring it to them or you find a way to get them easily because, for my residents to get from Meadowvale down to Sheridan Research Center is really hard. Multiple bus changes, and I'm not even sure if, I guess there is a bus that goes into along Speakman through there, but to get to that bus is a couple of changes, and it's not that easy, especially in winter. Thank you. But thank you, Sean. We'll talk. I do have land for you. I told you I have the land. We just have to talk about you building.
We love opportunities. There's one thing that we know that we need in Mississauga, and it is substantially more healthcare services.
Yes. Yeah. Good.
Thank you, Councillor Sato. Thank you, Sean. I'm not seeing anyone else with their hand up on the board. Just a couple of, for myself, a couple of follow-up comments. And as I was saying, most of my questions have been answered. Great to hear that the overall master plan for seniors, a regional one, that there's already been discussion with the local municipalities. I think that's extremely important. And also just to Councillor Sato's questions and comments about the adult day services. With regards to providing mobile services, with regards to the many different seniors groups located throughout the region, I know my experience with the various seniors groups that I'm in contact with. So one of the issues is that they would like to be able to provide, as Councillor Sato was pointing out, some of these day program services, but they just do not have the capacity, number one, in applying for funding, or they're not necessarily aware of or don't have the capacity to apply for that funding, and or just in terms of a connection between themselves and either the region or the hospital in terms of what the needs that they're hearing to provide what services to those seniors that are already participating in their programs. So both Sean and Donna, you talked about, and Councillor Sato mentioned the importance of making sure that there's collaboration and connection and looking at solutions to provide whatever it is in terms of ongoing supports for the seniors. And it's not necessarily going to be through supports at one hub, because we're not able to obviously have a hub in every single neighborhood. But what we do have in place in neighborhoods throughout the region are these seniors groups that are quite vocally wanting to support in every way they can their peers, their senior peers, but also contribute to the overall conversation. So, and one other point about the seniors groups and day programs for seniors is that what I hear from, so one I hear is just the capacity or funding or supports to provide to them to apply for funding. But then the other thing is that many of them, there's cultural barriers. So in terms of isolation with seniors, what they hear and what's lacking, even virtually, where they've made every effort to try to virtually have meetings once a month or provide programming to the seniors in their groups, is that it can be a real challenge to do virtual programming and connect with members of their seniors groups when it comes to language barriers or language concerns. So that's just something else to consider when we're looking at how we can really support from a mental health perspective and also a physical health perspective, whether we look at it through mobile supports, or just making the seniors aware of what's out there and what supports are out there for them and what programs and services. So Yes. Oh, Councillor Demurla, your hand is up. Go ahead.
Thank you, Chair Fonseca. Just had a quick question aside for Sean Kerr, since he's here. Sean, all this talk about services for seniors just jogged my memory. Could you give a quick update on the status of the long-term care home that we're building in Mississauga, where it's at?
Yeah, happy to. And actually, we have a community town hall this evening, virtual, of course, with Councillor Raz and MPP Cazzetto. So you'll recall we kind of have an original vision and scope for that plan, and then this summer the government of Ontario announced an accelerated build program, which would accelerate the build of the home through use of modular construction and streamlining of various processes. And so instead of looking at about a 3-year construction, we're looking at about an 18-month construction. That home on Speakman Drive is now, the work is underway. The site has been cleared. We are getting very close to a foundation, and it will be complete in the late winter, early spring of next year. So it's going to be very, very rapid build. What it'll be is 2 long-term care homes attached in the middle, each home with around 320 beds, so almost 640 beds between the 2. It'll be a combination of standard long-term care services, but then also specialty services. So, and Nancy and the folks of the region know this well, we have big challenges around behaviors associated with dementia, so we're going to have some specialized dementia units there. We'll also be offering satellite dialysis within the home, which is a major capacity pressure that we're experiencing here in Mississauga. And we've got an adult day program as well in the home. We'll be doing research, teaching, innovation, all sorts of really interesting partnership work there. And then also on the campus, we're going to have the Heart House Hospice, and that'll be the first residential hospice here in Mississauga. We're the biggest city in the country without a residential hospice, and so these are going to bring some very, very needed services to the community. And some of the features around the design, we saw this in the devastation that we've experienced in long-term care that many have seen over the last year. A part of the reason we've seen that is because of the physical infrastructure, the build. And so one of the design features we're really excited about is there's going to be 2 types of rooms, one fully private, which will be your own bathroom, your own room, and then the semi-private, you're going to have your own room and you have a shared bathroom. So that's a big change from what you can see in some of the older homes with 2, 3, sometimes 4 residents in a room. And there's a number of other design features that will really make this a caring experience. But what is the most important thing at the end of the day? It is how you run your home. It's the leadership. It's the quality oversight. It's the quality of the programming. It's the people, the staff who provide that direct resident care every day. And so that's really, as we're watching the construction, that's really what we're focusing on. How is this home, the care model, going to reflect the values of our organization and of our community? Because that's what we would all expect for ourselves, and that's certainly what our seniors deserve here in Mississauga.
Can I just ask a follow-up question? If my memory serves me right, when we announced it, I thought the beds were going to be culturally sensitive for the Indian community. Was that another long-term care? I thought it was the one in Mississauga. Maybe you can just clarify that for me.
Yeah, absolutely. So there's 2 projects that we have. So the one that I just described, and then the project that you're talking about is a partnership with Indus Community Services and Yihong Center for Geriatric Care, and that would be a culturally appropriate care model there. That would be something that has not happened in the country at this scale that we were really excited about, and that when I mentioned earlier to Councillor Sato that we're still looking for a property in Mississauga, that is what our vision would be. We would find that property for that home. That would be 320 beds, and we would be looking at a property that would allow us to have more integrated services as well. Additional services on that site. It's really a hub that we would be looking to do.
Thank you.
Thank you, Councillor Demerla, for those questions. So that's great. Seeing no further hands, thank you, everyone, for very, very good, fulsome discussion. Thank you, Donna, for the presentation. And Councillor Sato, would you like to move the presentation and move receipt? Wonderful. Any objections? All right, that moves forward. Thank you, everybody. We have no communication items. Number 7 is other business. Does anyone have any other business? Again, seeing no hands. So I actually do have one question under other business. So I know that staff are currently working on for this committee an updated terms of reference now that we have the now that we've moved forward in terms of a number of updates. So I guess my question to staff, perhaps to Brian, or I see Helena's hand raised.
Hi, Chair Fonseca. I was just going to ask for a retroactive motion to approve the agenda before we adjourn. Thank you.
Okay, I'll just go through with my question under other business. Is that okay? And then procedurally, and then I'll ask for the retroactive approval of the agenda we've just gone through. So, okay, so yes, to Brian, is there a possible, or when will we see a possible update on a report on the terms of reference? Could that be brought back at the May meeting?
Hi, Councillor. Through the chair, thank you. I'm glad you can hear me. Yes, we could target the May meeting for that. We'd like to, have a little consultation with yourself and as you direct perhaps other members on the committee to get their insight into the direction of the committee, as well as with staff and the leadership at the region just to help make this as a productive and effective committee as it was intended. So May, just given with the mass vaccination, may be a little bit tight, but I think absolutely we can target that for you. Okay, that's great to hear. Seeing nothing further with regards to any other business, I will now go back and I need somebody to approve the agenda. So perhaps moved by Councillor Vicente. Any objections? There we go, and that is moved. Elena, am I missing anything procedurally, or is that all good?
No, that's great. Thank you so much. Thank you.
Excellent. Having to adapt in these virtual times. So, okay, thank you. Moving on to no in camera. Then item 9, our next meeting is Thursday, May 6th at 11 a.m. And finally on to adjournment. Councillor Sato, would you like to move adjournment? Well, thank you very much, everyone. And we will see all of you, or some of you I will see virtually sooner, but see everybody for this committee on May 6th. Thank you for your time today.